Good afternoon. Welcome to Crossroads Chiropractic Facebook Live. I'm Dr. Josh.
I'm Dr. Kristina. Hi.
And we got some good stuff today.
Yes.
Yeah, so we've actually are going to start changing the trend of how we do our videos. So usually we do a topic per week, but what we're going to do is we're going to extend the topics because we've had a lot of questions from people about specific issues and specific conditions. So we want to break those down a little bit more in detail.
Yeah.
And so we're talking about it.
Yay.
So today we're going to talk about disc.
Discs, yeah.
So it's not a D-I-S-K, a D-I-S-C.
Yes, exactly.
Disc. I make that mistake all the time. It's not a computer
It's
disc.
not like a floppy disk.
It's not a floppy disk.
For those of you who remember what that is.
That's right. It's a spinal disc. So,
exactly.
So basically what we're going to talk about today is we're going to discuss the difference between a slip disc, a bulge disc, and a herniated disc. So let's start talking about the bulge and the herniation, then we'll talk about the slip. Want to do that?
Yeah, sure.
Okay. So
let's get our spine first.
Let's get our spine first so you can actually see what it is. So basically, really, as far as, and you may correct me, Dr. Kristina, but the way that I explain the difference between a bulge disc and a herniated disc is they're pretty much the same thing, versus the bulge disc is not symptomatic and the herniated disc is symptomatic. That's kind of how I look at it.
That's how you look at it?
Yeah.
Okay. I view it just slightly differently.
Okay, so you do differently.
Yeah.
I probably should discuss this earlier.
That's okay. I view a herniated disc as when, because there's a little cushy or smooshy part in the center of your disc, and when that pushes all the way through the fibrous rings to the outside, and you get the pulpy bit protruding outside, to me that's a herniation.
Yeah, I think you're probably right.
But then a disc bulge is when there's actual bulging of the disc itself. Yeah. Nothing has protruded through, it's just bulging out. And usually it is asymptomatic or not symptomatic.
Yes, that's interesting. There was they actually did a study years ago, and they took random people, 100 people off the street, and they did MRIs of them, and they found 75% of them had disc herniations.
Or disc bulges.
Yeah, which is pretty
and they didn't even know.
And they didn't even know about it. They were completely asymptomatic. So that's why, we're concerned about the disc herniations. We're concerned about the disc bulges, but the reality is a lot of people have them and they don't even know.
Yeah.
Which is pretty crazy.
It is crazy, for sure.
So if we're talking about the anatomy, we probably should have a slice so that you can actually kind of see.
Actually, yeah. Do we have something like that?
There we go.
Oh, okay.
Someone stole it.
One day.
But yeah, so
good.
basically your disc is basically it's fibrous on the outside and it's jelly on the inside, right? And if that jelly comes out, that's the herniation.
That's the herniation.
You're absolutely right about how you described it.
And it's the disc right here that's in between. Like this is one vertebra, that's another, and it's this part right in here. Yeah.
I call it the hockey puck.
The hockey puck?
The hockey puck, because it's kind of like...
Yeah, I guess so.
Because we're Canadian, right? People can understand a hockey puck.
There you go.
So the challenge with disc herniations is when they are inflamed and when you do have symptoms, they're kind of a challenge to deal with because every time you walk, every time you put pressure on your spine, you're actually going to be putting pressure on the disc, and you're going to actually push more of that jelly out into the area. It's going to irritate the nerve more. It's going to cause more inflammation. And research has shown it's actually interesting because back in the day, years and years ago, they used to teach that it was the nerves. It wasn't the nerves on the discs that was the issue, but they're actually finding there's more nerves in the discs themselves as opposed to the nerves coming out of the area. Originally, they thought that when you had this bulge, it was just this nerve, so you can see that's a little bit of a bulge, a little red. That was the issue, but they're actually finding that it's actually the nerves in the disc itself that is what's irritated, which makes it very, very complicated. So there's a lot of, and we're going to talk about the treatments on another video. Yeah, we're not going to end it because it can be pretty complicated, and we want to make sure we give as accurate information.
Yes, exactly. And it's also, maybe it's the same study, I'm not sure, but that when you've had a disc herniation and it's healing, it actually becomes more innervated, so you can have residual pain because of the damage that was already done there.
That's interesting.
Yeah.
So basically the bottom line is you want to take care of your back so you don't get to that point, right?
Exactly.
And so the reason why they did that study and they found so many people had herniations, they didn't know about it, is if they had actually gone through a chiropractic assessment, they would have found that they were subluxated and their spine wasn't working properly because that's how they actually happen, is just a spine that's just not working. The engineering and the forces of the spine are not working the way they're supposed to, and you get that you get that damage, right? And so not a good thing.
No, definitely not.
So herniation, what's that difference between a slip disc?
Well, a slip disc is just really slang.
It's slang.
It actually doesn't mean anything.
Yeah.
Because a slip disc can refer to a disc herniation, can refer to just low back pain, can refer to sciatica. People just attribute, I have a slip disc, and I have this pain in my buttock or down my leg. Yeah. But really, it means nothing.
Yeah, absolutely. Your spine shouldn't slip.
No.
There should be no slipping in that disc.
No.
Everything should be
if you
nice
had if your spine slipped on itself and you had a section slipped forward, you would have significant issues.
Yes, absolutely.
You probably would have trouble. I mean, you might not even be able to walk. I mean, that would just be really bad.
Yep. Not good.
And that's very, very hard to happen in the body because of all the ligaments and the muscles and everything running up and down the spine. It stays connected very well.
So that's your introduction into the disc.
The disc.
D-I-S-C. So disc herniation, disc bulge, and the slip disc, right? So
that's it.
Again, if someone comes into our office and says, "Doc, I have a slip disc," we're not going to get mad. We're not going to tease you. Don't worry. We say it all the time too, because it's sometimes just the easiest thing to say, right? But yeah, no, can't happen. No. And if you have a disc herniation, we're concerned about that. And really, you know what? We're going to talk about the treatments, but the best thing really for most patients for spinal health is chiropractic care, right?
Mm-hmm. Yep.
Making sure your spine's healthy. And we're going to talk about that. So if you're seeing a chiropractor,
awesome.
keep seeing your chiropractor.
Yay.
If you got a slip disc, first thing you should do is definitely book an appointment with a local chiropractor, get it checked out, and see if they can help. And if you're looking for a chiropractor in the area and you're not seeing one,
come see us.
I know two. I know two really good ones in this room. Two really good ones in this room.
I think we know somebody.
We know somebody.
We might.
We know somebody. So then we can refer you to. So,
exactly.
If you like this video, please share it. Send it to all your friends, family members, or even someone you may know who has some questions about disc herniation, disc bulge. Send them this video and tell them to keep posted because we're going to talk about treatments and home remedies, and some lifestyle things
changes
that you can do to get better, which is awesome.
That can help.
Exactly. Help for you.
Yes.
You got to wait for that though.
Awesome.
Yep. So follow us on Facebook, Twitter, Instagram. Check us on our website, www.crosschiro.ca. And
we'll see you next time.
Awesome.
Have a great week.
Talk to you later.
Bye.
I was going to say let your backbones died.